I just got back from my 3-week checkup with Dr. Saltz, and he was kind enough to record a video explaining the procedure. I still have a lot of swelling, and but it is going to take some time. Still have a bit of a bruise right there. I can raise this eyebrow. This side is still asleep. I had a lot more swelling on this side. The video is a little bit long, so you can press the side to make it go faster. Why do I look Chinese? Explain to me. And then also my smile. Those are my biggest concerns.
Okay, so she's asking why she looks Chinese. Actually, I think you look great. I think you look
Thank
great.
you.
But you're still in that period of time that's still a lot of swelling, a little more on the right side than the left. Very common. Sometimes during surgery, there's more trauma in one side, you have more swelling. Sometimes it's the side that you sleep in, so a lot of the lymphatic drainage migrate through that side. So it could be a lot of reasons, but all the nerves are working. I know your smile is very tight. Remember, we went down from here all the way down into the buccal space, and then we did a very tight fixation. So think about this whole trajectory has been violated by instruments, by an endoscope. So the body is now healing that tunnel, that pocket. And the body heals by more swelling, more blood supply, sometimes pain, sometimes discomfort. So all your symptoms are completely normal.
Okay.
When I see a patient after surgery, endoscopic surgery or a facelift surgery, I always look for, are the nerves working? Is she smiling? And in your case, everything is working. Everything looks great. But it's tight, it feels heavy, my brows don't move. That's normal for this period,
3 weeks.
For 3 weeks for recovery. Okay. Yeah.
Okay.
And actually, I don't think you look Chinese. I think I like it. I think it opened up your.
I feel like I'm a little Asian.
You open up your brows. You open up your eyes. But all that goes back to normal.
Okay. So, and then you mentioned the humps, the little humps up here. Can you explain why I have those little humps?
So the humps are the endotines. The endotines are those little devices. Think of like a Velcro that is connected to your bone, the skull, and is holding those 5 little hooks are holding the periosteum. Right. If you think in the 90s when we did brow lifts, we're not doing a lot of fixation, and a lot of them fail. They look great for a few weeks and then boom, they drop. So we learned very quickly you need some kind of fixation. So I just showed you in my laptop. So we try glues, we try sutures, we try screws that actually were sticking out, and the 3 weeks patients would come in and actually we unscrew. And it was not a great fixation because you had to remove it at 3 weeks, because if you didn't, some patients could have infection on the bone like osteomyelitis. So in 2002, this company came out with the endotines. And I love the endotines. Why? Because they provide a very good solid fixation. It's easy to get good symmetry, as I showed you in that video. And then they disappear. Right. They're made out of a suture product that you make suture material. And within 6 to 12 months, they dissolve. Right.
So same with the bands that I have from here all the way down to here. Those are going to dissolve as well.
Same material.
Okay.
And it's great because they provide the fixation that we need. They allow the body, the tissues, to glue into this new location, and then they're gone. Okay. So it's a temporary support, so the tissues can heal now in a higher position.
So you would say that it's more like 6 to 8 weeks before I could see.
I think in your 6 weeks visit, you won't look so much Chinese. I'll be upset, but you're gonna love it. Yeah. I think a lot of the swelling also is gonna come down. It's gonna start looking more natural. You're gonna feel like, oh, that's me again.
Okay.
But you're still gonna have fullness here. You're still gonna have this nice round mid face that we got with your surgery.
Okay. Thank you so much for explaining.
Thank you. Thank you. Very good question.